هي شادي شباك خلينا نشاركها طيب اوكي شادي المفروض to join us anytime. Well, first of all would like to welcome everybody with us today in this webinar regarding matching in general surgery in the United States. We're trying to provide summary of the Jordanian experience. We have an excellent panelist with us who has gone through all this process. We are live now on Facebook, my personal page, also the General Surgery Club page, also the STBC Joe live on Instagram. We have with us Dr. Mohammed Al-Jashad. He is a complex surgical oncology fellow at Johns Hopkins. We're very proud of him. We have our big brother, Shadi Abu Halimo. He's an assistant professor of vascular surgery at West Virginia University in Charleston. We have our wonderful female surgeon, Dr. Yaqeen Liqta, who just finished her general surgery residency from Rutgers University. So, matching into general surgery in the United States, we're trying to provide summary of the Jordanian experiences. The question first, is it possible? Okay, so basically back in early 2000s, when I was in medical school, we knew about only few Jordanians who were able to match into general surgery into the United States. They believe were almost impossible to do so, with multiple people have tried and didn't make it. Most surgeons at that time were coming from United Kingdom. Others were locally trained and had done fellowships in the UK. No governmental or institutional sponsorship available, similar to other, let's say, friends from the Gulf country, where basically, there is very easy to get sponsorship to match into go into general surgery with full governmental sponsorship. And then basically we had none or few in Jordan at that time. And basically they believe that if you want to do surgery, you should only try the UK only. Basically, general surgery in the United States for us at that time were, I'm sure those who are old enough to know the ER series, it's Dr. Benton. If you remember Dr. Benton, the hardworking surgeon who's very smart, very passionate about taking care of patients. So basically, that's our role model in general surgery in the United States. This is how we thought about it. And this is how we think it is basically surgery is so let's say giving in the United States. In 2001, 2002, we heard for the first time for two University of Jordan graduates who matched into general surgery. One of them is Dr. Abu Halima with us today. And we started to have a different perspective on the subject. Is it possible and how we can get it? This is a very nice survey about hurdles in the US surgical training for IMGs. Majority of general surgery residency programs directors believe that IMGs are subjected to discrimination during the candidate selection process. 20% of the program directors felt pressure to rank less qualified American grads above IMGs. If you look at the data from this year match, the 2020 year match about general surgery, basically you'll find there's almost 1,536 positions offered for categorical. Only 4 went unfilled. The majority were filled by either an MD seniors, around 1,033 MD seniors, that's mean graduates from the American medical schools, and the 202 graduates of actually the DO programs, osteopathic medical schools. So around 1,235 are matched by American grads, and only 200, around less than 200 are left for IMGs, either a US IMG, the one who has US citizenship, and non-US IMGs, basically who are the minority in this field. And actually most of our Jordanian graduates feel in this category. But the fact that you should know the majority of IMGs matching into categorical positions actually completed already a preliminary year, something to keep in mind. You see the big difference of the number of positions offered for medicine, family medicine, pediatric, compared to surgery which is, you can find it right here, 1,500 almost compared to almost 10,000. The good news is that the number of IMGs matching into general surgery over the last 4 years has been increasing, if you notice here. Basically 139 in 2016, 133 in 2017, and now in 2020 is almost 180 IMG matching into general surgery. This is something should be promising for foreign medical graduates regarding surgery. Again, we're talking about categorical only, not preliminary. You see the preliminary, there's a lot of positions going unfilled in general. You see how competitive is general surgery. In 2019, there were no unfilled position. In 2020, only 5 unfilled positions. Over the last, 20 years, I had a really extensive search for all surgeons who are Jordanian surgeons who are diplomats of the American Board of Surgery or who are actually in training right now. So I could find total of 58 Jordanians who had done general surgery residency in the United States. The first 7 here are senior surgeons who came back in 1980s, and since then they've been practicing in Amman, Jordan. The rest had either stayed in the United States or came back over the last 10 years. And then basically we have a good number of actually trainees in training or maybe finishing training this year from all over the United States, from Hopkins, Mayo Clinic, Maryland, everywhere. And we have some Jordanians who actually had done medical school in Ireland, Royal College of Surgeons, and actually also match into surgery, and they're practicing in the United States right now. So a total of 58 Jordanians who had done or had the American Board of Surgery or had done fellowship, or they're in training right now. I had the pleasure to meet a few who are in the last meeting in San Francisco. All these either surgeon practicing in the States or actually have done in their final year of training. And I know the board was canceled, was supposed to be yesterday. So basically they were due for their boards. All of them are doing fellowships right now in the States. So what I did is a summary, a questionnaire, a survey through SurveyMonkey to 40 Jordanian surgeons who are actually basically, I had their connections and I could reach them out. And I had, we sent it to 40 of them and 29 had responded, which is a 72% response rate, which is a good response rate for surveys in general. If you see, majority of them are in the 3rd and 4th decade of life. A few are in their 6th decade of life. Again, we have 54 males, my statistics, and 4 females who had done general surgery in the United States. Majority of the 29 who had responded were graduates from the University of Jordan, some from JUST, and we are now start to see the Hashemite University graduates matching into general surgery. Basically, majority had done an internship in Jordan. 28 had done, 1 did not do it. Did you do any general surgery residency? Again, 29 had started some sort of general surgery training in Jordan. 20 did not. So basically, the majority after their internship done 1 or 2 years in Jordan and then went to United States. For those who did general surgery training in Jordan, majority had done 1 year, some had done 2, some had done 3, and we have few who had done 5, actually finished their general surgery training and started again in the United States. Basically, again, you see 2 had done a full 5-year training in Jordan and started residency again in the United States. In terms of electives, the majority, actually 21 out of 29 who responded had done some sort of hands-on elective in general surgery. Most of them had done 1 or 2 months. Few have done 3 or 4 months, but again, majority had done 1 or 2 months. In terms of those who could not make it for general surgery resident electives, did you do an observership? Again, you see some had done observership. The majority did not do any observership. And again, those who had done observership were either 1 or 2 months. In terms of research, it went 50-50, around 48 had done research, 51 did not do research. basically, in terms of the research job, 40% were a paid research job, 40% were not paid, and 16% started unpaid and went to paid again. Majority of the research were clinical research. Some had done basic science research. In terms of those regarding the preliminary year, the majority actually had done a preliminary year of general surgery before matching into categorical. You see 24 had done preliminary year, 5 did match without doing a preliminary year in general surgery. The majority had done only 1 year, some had done 2 years, one had done actually 3 years, and I know another one who had done 3 years of preliminary until he matched into general surgery, and eventually he did match. Majority were accepted, 64% in the same program, 35% had matched into different programs, but through the help of their program directors. So again, still majority had matched into the same program. Those who had done general surgery in the United States before coming to the United States, actually, some of them had done full fellowship, 1 or 2 years fellowship, either critical care or transplant, before matching again into general surgery. The majority, 65% were, or 2/3 of the hospitals were academic hospitals, and 1/3 were community hospitals. Most of them had considered 60% their program is IMG friendly. That's something we should look for it. And in terms of the visa, majority were on type J1 visa, few were in H1B visa, and some did not need a visa. Again, those who had done fellowships before. So basically, in terms of where they're practicing now, 15 actually, including the 8 senior surgeons, are practicing in Amman right now. 18 are still in training, 23 are practicing in the States, and 2 actually practicing in the Gulf area. If we try, I asked the general surgeons who are actually diplomats of the American Board of Surgery, what in terms of the importance of every single item here in terms of hands-on elective, you see the majority of the responses were either important, fairly important, and extremely important. So 75% think it's very important to have a hands-on elective. In terms of the observership, actually, it's the majority think it's not important. 22% not important, slightly important 27%, and important 31%. And few thought it is actually important. So observership, according to the Jordanian experience, is not that important. USMLE scores, it's very important, as you can see here, and we'll talk about it. Having step 3 with, under your hands, majority think it's not important. Research experience, as you can see, majority think it is very important. In terms of number of publications, let's say it's kind of fairly either important or slightly important, but not that important according to the Jordanian who match. Preliminary year, very important, as you can see here. Connection in the United States, also very important. And basically, if done a fellowship before coming here, it's not important. So matching into general surgery, you can see it is difficult, but possible. Planning should start in medical school. Doing 1 or 2 year of 1 or 2 months of elective in surgery is helpful. Doing research is helpful. The above 2 points will help you make connection in the United States. Majority of Jordanians made it after 1 year of preliminary in the same program. Basically, few started general surgery residency in Jordan, and few had gone through general surgery in Jordan, fellowship, and then back into United States. Matching into general surgery. Again, this is another study that found how we select our residents, a survey of program directors. You'll see most of the general surgery residency program directors use step 1 as a screening tool. Basically, those who are below certain numbers, they will be excluded from the selection process. And then graduates from American Medical School really makes a big difference. But the most important factor for ranking candidates was the interview. I would like to thank you all for being here, and I would like to ask our, my panelists to provide some information about their experience. We'll start with Dr. Abu Halime. Shadi, can you help us? Shadi. Shadi, are you with us?
Yeah, I'm Amir. Yeah. Can you hear me?
Yes, we can hear you.
السلام عليكم. الله يعطيك الف عافية. Thanks, Osama, for the invitation, and thanks to everybody. I know there's some people just sending some chatting. Hopefully, we can answer some questions at the end.
So, can you just tell us about your experience?
So, my experience is I finished 2000 from University of Jordan. I did well in the exam. I mean, during my school, which does help for the match. So the better you do in school, the better you can have chance matching. Alhamdulillah, I just actually I ended up doing 1 year, which is MTS, and I was very pessimistic about matching in the United States. Everybody that actually, I was one of the early ones, not the early one, but I was one of the early ones that matched earlier. But a lot of people say, don't go there, don't waste your time, which I think is stupid. If you have a dream, you should just go and pursue it. So I did 2 years of general surgery in Jordan, and I decided to skip even University of Jordan, which they offered me a residency, because I want to operate. We go for surgery because we like to operate. So I ended up going to Wizat al-Saha. And I did excellent. I mean, I love it there. But of course, the academic portion was very bad, unfortunately. At least it was not structured much. And during these years, with the help of some of my really, really close friends and my family, I decided just to try and go to the United States. So I started by applying. I actually came in 2002, did my second step 2, and I literally flew to the United States to do the CS Spark. At that time, I applied for, if I remember, around 100 programs. I applied for, of course, you can apply for both preliminary categories, so I applied for both of them, and I got 6 interviews. So I got 6 interviews, and I decided not to leave the United States at that time, which almost compromised my residency in Jordan, although I asked for to be off at that time. So alhamdulillah, I went there and applied for the 6. I went to interview for these 6 places. Here's the good thing about, and I'm talking about even me as part of a residency program near a vascular residency program, more than general surgery program. When people apply and they give you an interview, I can tell my applicants or my residents, throw away your application. We still like to look at it, but you need to prove yourself during the interview. So if you prove yourself during the interview, there's a very high chance we're gonna actually love you and match you. If you are the smartest guy on earth, but you did not really impress me in the interview, there's a very low chance you're gonna match. So there's of course tricks that you can impress people we can talk about later on. But so I interviewed 6 places. 5 out of 6 places, they actually asked me at the end of the interview, are you applying for categorical or preliminary? And of course, all of them, I said, categorical, of course. But if you give me a preliminary, it would be nice. Alhamdulillah, one of the place actually, which I think at that time was really friendly, was in Philadelphia. The program director asked me, he's like, hey, come here for preliminary position. I think I will like you the way you just talk, the way your CV is. And most probably I will give you a preliminary spot. If not a second year, probably a first year. I'll give you actually a categorical spot. So I decided not to play that game. And I went to the place that actually I was still working, which is West Virginia University. They were very optimistic. That one of the guys there, he's from Jordan. He's a Jordanian physician, but he immigrated to the United States probably 35 years ago. So he said, I think you have better chance to stay here. And alhamdulillah, I actually interviewed there. I got a preliminary spot. So yes, Osama.
So again, your story was inspirational for a lot of us at that time. So, hearing a lot of people who would not be able to make it. But I'm gonna switch gears now and talk to Muhammad Al-Afeshat. Muhammad, mashallah, you've done great so far, mashallah, matching into Johns Hopkins. You'll be the first Jordanians who actually is going to graduate from general surgery from Johns Hopkins. And actually, you're doing also a complex GI oncology there, which is again a great place to be. Tell us about your experience and basically how basically you ended up doing such thing.
السلام عليكم جميعا. أنا طبعا أشكر الدكتور أسامة محمد على الانفيتيشن I just want to echo everything actually Dr. Abu Halima said. I think also I agree with all the results of the survey that you mentioned. For me, I graduated بال 2011 من University of Jordan. عملت سنة الامتياز، بعدين عملت transitional year بمركز الحسين للسرطان, which it's a great place. I highly recommend for anybody who's doing even internal medicine or general surgery. It's a great year to stay clinically active. Markaz al-Hussein, they have like a lot of, different kind of transition residency where you can just basically prepare yourself for the residence in the US. They have some of the same kind of policies or guidelines that you will practice in the US. But anyways, I did my USMLEs during the Central Imtiaz. I did well with USMLEs. During medical school, I did 2 sub-Is, one of them at Harvard at the Brigham, and then the other one in Northwestern. And I think the letters of recommendation is the most important thing. I mean, obviously, USMLEs is really important, but the US experience, in my opinion, is the number one, because you can bring like, 5 letters of recommendation from a lot of our very dear and beloved attendings in the University of Jordan. But for the program directors, if they don't know the person, they will not basically approve of that letter of recommendation, or they're not like trusted or put a lot of weight on it. So I think the most important thing is to get hands-on experience, not observership, hands-on experience in university or academic program in the US. It doesn't matter. It doesn't have to be even top tier. As long as you have from like, big name attending letter of recommendation, this is the most important thing. But then, I applied also widely about 100 program. They were also very well selected. So it wasn't random. So it's kind of like, the word of mouth about which programs are more IMG friendly. You have to do your homework. There's a very like helpful list at the JAP group about like where the Jordanians match before in surgery. And these are basically the biggest bang for your buck. As you can, imagine, these applications are really costly for the medical students or the applicants in general. So 100, I think, is a reasonable, especially if it's in well-selected programs. And then I got about 7 interviews. Some of them were categorical, some of them prelims. The way I thought about it, I probably could have matched off the bat to a community program. But for me, because I wanted to stay in academic surgery, I was like, let me just, take this, you can call it risk, into prelim. I saw some questions in the chat about what prelim. Prelim يعني اسمها سنة مؤقتة. يعني it's just that 1 year, it's a 1-year contract. There's no guarantee that they will take you for a 2nd year or, take you as a category. So it's just a 1-year preliminary surgery. There's designated and non-designated. Designated meaning like for some people who are going to radiology, who are going to like other specialties, they need 1-year prelim. They someone designated. Non-designated for prelim surgery, that means for people like us going to general surgery, you start as the prelim and then you do a good job. They either keep you in the same program or help you get a position somewhere else. طبعا أنا بالنسبة لي, I did 1 year at Hopkins, and then during the 2nd year they took me in as a categorical. طبعا توفيق رب العالمين ورضا والدين. Obviously you have to do a good job, but I think at Hopkins we have a good record of Jordanian applicants who interviewed at Hopkins, who came here and did a good job. وعندنا إن شاء الله Raneem, currently she's a prelim. Hopefully إن شاء الله she will stay. She's doing a fantastic job. So I just want to send a message to all the students. It's not impossible. If you do well in your exam, do hands-on experience, you come here as a prelim, you do a good job, you're either going to match at a big academic program, in the same program, or somewhere else.
Thank you, Muhammad. Before we start taking questions, again, you can type your questions either on the Zoom, you can type it on Facebook, also you can type it on Instagram. Yaqeen, basically you finished your General Surgery Residency. As I really choose you because you are a girl with a hijab. I'm sure you had faced a lot of difficulties matching general surgery and finishing general surgery. I want you to talk about your experience with the challenges.
Okay. Assalamu alaikum, everyone. So I also saw a message they're requesting that we speak in English. So basically, alhamdulillah, so I graduated in 2014 from University of Jordan, and then I did my internship in the University of Jordan Hospital, and just in case I'm not able to match in the United States. But then So one of the things that during my 6th year, as you all know, that you get the chance to do 2 months of elective anywhere you want. So أنا طلع لي 1 month where I went to Vanderbilt مع الجامعة. The second month, I did 1 month of elective in my clinic, Rochester, Minnesota. So super important thing, and the thing that really helped me, alhamdulillah, in this journey, that I did my step 1 when I was a student. يعني أنا خلصت step 1 أنا بسنة 5, خلصت step 2 أنا بسنة 6. So when I applied for this elective in Mayo, like they requested أن يكون أنت عامل step 1. So like I applied and like I was accepted right away للelective, and then it's just an elective bus. They wanted step 1. عشان هيك في كتير ناس ما بيقدروا يعملوا electives لأنهم they require it. المهم, so I did that month in my clinic, I really enjoyed it, واشتغلت مع one of the attendings, they wrote me a really strong letter of recommendation. But then when the match time came, like I applied to both categorical and prelim surgery positions, I ranked my clinic أول واحدة. So the most important thing that I knew, like أنا بماي clinic تعرفت على ناس أردنيين, دكتور محمد خصاونة, دكتور يزن الجمال كمان, وthey حكوا لي عن their experience there, like how the like hard work pays off. I knew إنه إذا أنت كنت prelim ممكن ياخدوك. So that was a huge plus for me, لأنه بكتير positions بكتير مستشفيات prelim بيحكوا لك إنه إحنا ما رح ناخدك, بس ممكن يحكوا لك إنه أوكي إحنا رح نساعدك تلاقي محل. So I would recommend, always when you rank those places, and you rank the place that you know that you like, there's a chance that you can stay, even if it's like super competitive, but at least there is an existing system يسمح لك بهذا الشيء. فبهاي مرحلة البريلم basically انتو يعني بيعملوك سيمي مثل الانترن كاتيجوري تبعهم. Like some rotations are different, but for the most part you're like doing the whole like clinical work. You go to operative assisting. هلا بعد هاي البريلم year بمايو clinic, I did another prelim year ب Michigan, and I was offered then a categorical spot in New Jersey. Going back to when I did my prelim in Mayo Clinic, they really helped me like through this whole process, had to get my categorical spot in New Jersey. So I was lucky from that standpoint. Also at the same time, in الواحد يعني important إن الواحد يثبت حاله والconnections, right? But also very important, which I noticed, that like of course your academics. Your step 1 was super important for me. وثاني شيء I didn't actually know that coming to the US, بس انت علماتك بالجامعه بيطلعوا على هاي القصص. مثلا اذا في مثلا حدا عمره رسب ماده او عمره رسب سنه, they look at those things and it's like a red flag for them. مثلا اذا انت كنت جايب A's وهيك, like it's something كثير بيساعدك. هلا نرجع لموضوع ان انا بنت ومحجبه وبامريكا, انه يس بتذكر اول ما رحت على ناشفيل إنه ناس كانوا مستغربين, like in the OR وفي حجاب, I don't think they've ever seen something like that. بس شوي يعني the best way to handle this إنه know that some states are different than the others. لما مثلا رحت على Mayo Clinic, it's like إنه it's well known, it's diverse, في كتير ناس من كل الجنسيات, so it was a smoother transition to me. بعدين هون finishing my residency, going to my chief year وهيك, I never actually like felt خلال يعني كل ال5 سنين هدول إنه like I was never like إنه affected actively إنه حدا أي سمع لي حكي أو إشي racism, بس إنه sometimes بتحس إنه they may have some certain ideas about you. The only way to إنه أنت you just have to be able to express yourself وتحكي عن حالك, بيرتاحوا لك ساعتها وبيعرفوا إنه like having the hijab is not an obstacle. وبالعكس إنه my program director was like very proud of me, إنه like a Jordanian female من Jordan ومحجبة, so that was like also something for the program, إنه عندنا بنت محجبة for them. it's doable, يعني I think keys إنه أكيد زي already نحكي عن كل هاي النقاط, إنه واحد يعمل elective إذا ما قدر يعمل observership. ثاني شيء do your steps early on. ثالث شيء when you get the prelim position, أشياء تطلع عليه إنه إذا بيقدر ياخذوك, إذا لا how supportive they are, and you can kind of tell, تسأل الناس, تعرف تحكي مع الناس اللي عملوا prelim قبل معهم. وثالث شيء إنه يعني it's gonna be tough, but alhamdulillah at the end it's worth it يعني. But this is what I have to say.
Thank you Yaqeen. We're really proud of you, and good luck with you for you on your hopefully fellowship. Okay, a question for you, Shadi. Somebody is asking, hi, I'm a fourth-year surgical resident in Jordan. I did step 1 and 2 and CS certified. I'm planning to do a fellowship in USA. I have 2 questions, please. 1, the chance of a transplant fellowship. 2, can I apply this year like as a resident, or I have to finish my residency before?
So you can apply to a fellowship. You don't have to do a residency in the United States to apply for fellowships. And actually, up to my knowledge, I'm not with transplant surgery, but just from my friends, transplant is probably easier than other fellowships to match in. I mean, most of fellowships now in general surgery is getting tough to get to or into because unfortunately general surgery training, which is excellent compared to other countries, but still there's more and more people doing fellowships, which takes more cases from general surgery. So they want to be more confident by applying for fellowship, which I 100% agree. I think everybody should apply for fellowship, even general surgery fellowship sometimes. So, but I think you can apply from Jordan to fellowship. Unfortunately, you cannot go for your boards, but you can get the fellowship and you can go back to your country. Some people, actually, if you work for 3 years, you can apply for a work permit here, and you can work in the United States. So that's the first question. What's the second question?
Regarding second question, do you have to finish general surgery to apply for fellowship in Jordan? I mean, he has to be finishing general surgery to apply for, or he can maybe at BGY4 apply for fellowship?
So good question. Actually, I know people that they came to the States after MTS in Jordan, and they did fellowships. They did not even do residency. And then through this fellowship, they went back and did residency. The kids did a flip back. So it depends on the program. If they are desperate, unfortunately, they will take anybody. But most of the programs, the more your CV is complete, the more chance you will actually have better chance to match.
Okay, Muhammad Afeshat, somebody is asking, is there any advantage for surgery residents graduating from international Icgme accredited programs? Can you please answer?
So, I mean, as far as I can tell, none of these programs are available in Jordan. So I'm not sure how that pertain. I mean, of course, it will help with the surgical fellowship, but the surgical residency, I mean, I assume it will, but I actually have no experience in that. All I know is that in Jordan, none of these are, ACGME approved.
That just they're working on getting something, but I think maybe he's asking from Qatar or from UAE, Muhammad al-Zu'bi, where they have actually international ACGME accredited programs.
I think it does, because, for example, even if you're not in general surgery, for example, when we see applicants, like during I was in the interviewing committee for a couple of years. When we see applicants, for example, these Qatar Cornell, for example, these are like favored medical school over others. For example, Aga Khan in Pakistan, this is like one of the very well respected. So I think these things definitely help, and the reputation help for the institution.
Okay. Basically, somebody is asking how to prepare ourselves before graduating from medical school. Does home country research give you any advantage? Yaqeen, can you answer this? Home country research.
Sure. Actually, yeah, it does. So any research helps. أي شيء الواحد ممكن يعمل anything you do, like case reports, case series, هاي studies. لأنه at the end of the day, يعني they want to see that you're someone who's like invested in yourself and you work you publish something. So إنه أنت بتعرف بالresearch بغض النظر عن الموضوع. So yes, يعني مثلا أنا عملت one study مع الفاميلي medicine department وعملت one case report مع cardiovascular surgery. وهذول الشغلتين يعني they're like on my CV, they were published, so it gives me a point حتى لو إشي عربي.
Shadi, somebody is asking, does the number of publication matter? If yes, what's the minimum?
That's a good question. It does matter, of course. I mean, but I'll be honest with everybody. When we apply, we interview people. We look at the applicants. Of course, the bigger the CV, we look at what kind of research they do. Of course, look, the holy grail, the randomized controlled trials is the best. We know that you involve big names, that's also good. But as Yaqeen said, anything that will help. So anything you involve with the case reports or case series, I think will add up to your CV and make it, again, as I said, more complete. there's really no set number. But when it comes at the end of the day, when I match people, if I have a guy that has zero, not even a case report, and a guy with 20, he was involved with 20 research projects, unfortunately, I'm going to match with the guy with the 20. So there's no set number. I can tell you probably as a student, have 2, 3, maybe 4 in your CV is good. If anybody come to the United States, push to be involved with any collection of data, because they will put your name at least on these papers, and they can just add it to your CV. Even these 2 months, you can just collect data, be involved with these, even during elective.
Okay, very interesting question. Does the pass and fail new rules for step basically 1 will affect matching into general surgery, knowing that most general surgery program directors actually now most of them screen applicants based on the step 1 scores? What do you think, Mohammed Al-Fishat?
100%. I think that was very sad news for all the IMGs, not only in Jordan, like across. I think that put us at a huge disadvantage. I can speak for my program. I think the #1 filter that our program uses to filter applicants is the USMLE step 1 score, even more than step 2. So now, like our applicants basically have to like find other aspects to focus on. Like, you know, the research now becomes more important. The hands-on experience is more important, because now it's hard to distinguish themselves. Like Ananas, like they are amazing in terms of like, you know, their academic achievement in terms of USMLE scores. For example, my program director, if she sees a USMLE step 1 of 270, that's an automatic invite for an interview, right? But now that's gonna go away. So you gotta really like, you know, stand up, like your application has to stand out like somehow without the USMLE step 1 score. So unfortunately, yes, it does big time.
So basically, this is a big, let's say, invitation for actually publications, where people have to start really working on publications to improve their CV. What do you think, Yaqeen?
So I think it's not also only about research. You know, to answer the question that someone asked about, like what could we do to like basically improve I think that doing doing extracurricular activities is like super important. It was important, and now it's going to be more important starting like 2023 لما هذا القرار يصير, I think. Basically like volunteering, doing stuff like I know like in the University of Jordan في IFMSA, where basically like they do campaigns and بتطلعوا تعملوا screening, you educate people, or بتعملوا projects, you arrange and do conferences, all those things you should put on your CV, and they're really going to help you. And at the end of the day, like you are helping yourself in Intel, like you build your character, which is something they always want to see when you come to the United States. So research extracurricular activities. إذا ما في يعني مثلا organization حواليك يعني ينعمل, look for something. مثلا انتوا عندكم بكلية الطب, like invent something. روح عند العميد احكي له مثلا I want to invent this program مثلا بيساعد الطلاب to transition smoothly من من كلية للمستشفى, like something like that. Come up with it, and then it's going to be your project and develop it. So basically, I think, and يعني كل حدا like you need to sit down with yourself and think about like stuff to develop. بما إنه this is gonna, I do agree, and it's gonna affect IMGs, but you just have to be smart about it. Come on.
Great, thank you. So one of our attendees on Zoom, he said, as a program director of a fellowship, I believe that most important limiting factors preventing foreign grads from getting into surgery residency is the fact that they are not known quantity. So applying to places where Jordanians has done well in their programs, or applying to prelims, to me is the most important factor, is the letter of recommendation. We agree strongly with you that, again, finding where Jordanians were applying to the same programs, basically they know what they are facing, like what Mohammed Al-Fishat has set a great example in Hopkins, Shadi at West Virginia, Yaqeen at Rutgers, and a lot of other Jordanians. Mayo Clinic, we have good reputations there. So definitely it's something we should really work on. Another question. Go ahead, Shadi.
One thing I think just everybody should keep in mind, applying to big places, I think give you a bigger chance to match as a prelim. I still believe doing a prelim surgery 1 year or even 2 years It's definitely not a waste of time. It's all experience you can add to your CV. You can do 7 years of residency, that's fine, but at the end of the day, you will match, inshallah. So applying to bigger places like Mayo Clinic, and that's what probably help with people that go to Mayo Clinic or go to Cleveland Clinic, is they have big panel of prelim residents. They need a lot of prelim residents to do the job. And if you can prove yourself, which this is very important, you have to know the system quickly, and so you can match or apply to the match within 3 or 4 years, or 3 or 4 months, because that's when you start applying in October. So you have to prove yourself in 3 months, and then your chances, you're going to work with the big names in these places. Inshallah, you will match in the same place, Mayo or somewhere else, but you probably end up with a good letter of recommendation to do 2 or 3 months from the United States, which I'll be honest with you, I love to get a recommendation letter from Osama because I know Osama very well. But if I don't know the guy coming from Jordan, there's a lot of surgeons, I mean, prestigious surgeons in Jordan, but if I don't know them personally and I get a recommendation letter from a guy from the United States, I'll probably end up trusting it more. So yeah, go apply, guys, to big places. This is very important. They always need people. They always need people for research. They always need people for preliminary positions.
Okay, somebody says, can you share with us USMLE scores if you don't mind? Basically, again, these scores are fading away. It's going to be pass and fail soon. But most program directors used to take, I think, 220. I remember that when I was in the States, filtering for residents, 220, below it, they will not ask for, they will not go into the next process of selection. Above it, basically, you get into your program application will be locked in. What do you think, Yaqeen? Is it 220 that most program used? We can't hear you, Yaqeen. We can't hear you. Yaqeen, we can't.
Okay, sorry.
Yeah.
So yeah, basically, I think that every year it's like for some reason, like mashallah al-alamat, like they're going like skyrocket muqarani. Like when I was back in 2013, I did my step 1, and I don't mind. I mean, I got a 240 at that time. But I felt that you know, nas hawlay, yeah, 240 it was like better than average, but I could have also done better. You know what I'm trying to say? إنه هلا they're like much better وسائل دراسة الواحد يدرسهم، فعشان هيك يعني like people are getting 250s, 260s وهيك. But مثلا I'm speaking of my program Rutgers مثلا إحنا for our cutoff مثلا is 240 now. In هاي السنة we didn't invite anyone who's less than 240, which I'm trying again back to the point إنه العلامات كتير عم تعلى. فرفعنا العلامة. I think like I think like 220 now it's unfortunately 220 now it's not
maybe I'm old enough now to realize that I'm old. Thank you, Yaqeen.
No, it's not that what I meant, but
anyway, very good question is basically, Muhammad, how to prepare myself to the interviews, how to do well on the interviews?
I think this is a very important question. I think the way I look at the whole process, your application will get you an interview. Your performance in the interview will get you the spot. I mean, connections help. I mean, let's admit it. The connection will help you get the interview. But during the interview, if you don't do well, even if your connection is the program director themselves, you will not be accepted because it's always a committee. Like it's not a tyranny. Like usually the program director cannot make that decision based on themselves alone. So if you do not perform in every single station, the committee will not approve of you. So the tips, just to be more particular, the most important thing is to be normal, not to say like any weird things, because a lot of times, like we say, like this applicant is DNR, meaning do not rank, because of something weird that they say. So it's important to be like very, political with your answers, to be very careful with your answers, to be always smiling, even like, the looks of what you wear, like try not to stand out in the wrong way. And I think standing out in the wrong way is usually what disqualify people, while if you just like, kind of okay and did not stand out in a good way, you can still match. But if you stand out in the wrong way, I think that's usually it's an automatic like, exclusion. That's, I think, the most important thing about the interview. The usual stuff, questions, strength, weakness, like you have to do your homework, know everything about the program, have some insightful questions, but you need to be interactive. They need to feel that you're really interested in that program and that you would fit there.
Shadi, what do you think about the interview thing? How to prepare for yourself for a good interview?
Just give me 5 minutes. I'll finish this quickly, inshallah. But this is very important because this is actually one of the things that it's a political thing. So when I applied to the United States, my brother was doing medicine in Rhode Island with Brown University. I'm sorry to help also after Yaqeen. I actually scored like 240 and 245 in my scores. I scored, alhamdulillah, and that was. So at that time was like we had percentiles and all that. So it was really good at that time, and that's actually what people like about. Now, my brother, program director who's medicine, who later on helped him to get in cardiology, alhamdulillah, he asked, why your brother, he's too smart to apply for general surgery. We probably just bring him here, and he made me actually interview for medicine at Brown University as a backup, which is one thing you just keep in mind. You should actually have a backup. And during the he actually interviewed me, and the reason he interviewed me, he wants to do like we call a mock interview. So he wants to show me how to interview. I went there to see him as a friend, and he actually destroyed the way I actually interview. Our culture is completely different than American culture. They don't trust people. They don't like people with soft hands. They like to have somebody with strong personality, especially in general surgery. If you have a surgeon that apply or a resident apply, and he just shake your hand in just a polite way, which we do in our culture, alhamdulillah. We're good people. We're excellent people, alhamdulillah. But unfortunately, they want somebody that actually break your shoulder. That's what he told me. He said, your brother broke my shoulder and I had to match him that day, and you did not. So having a strong personality, as Muhammad say, I think you should not stand up in a weird way. You should actually show your strong personality. If you show your strong personality, I'll probably remember you out of 100 people interviewed that day. If I remember you that day, I probably have a high chance to match. So having a strong personality, maintaining a smile, maintaining eye-to-eye contact, don't laugh. Even if they give you a cracking joke, don't just start laughing crazy. If they talk about Jordan, be proud talking about Jordan. Tell them what's the excellent things that we, alhamdulillah, we have in Jordan. But at the same time, don't be a tourist, just say, no, you have to come here, I'll take you to Jordan, I'll buy you mansif. No. So just talk simple. Try to speak English with other people, because the moment you prepare yourself to speak English, we're not going to be we're not going to be American at the end of the day. We still have an accent. But they want somebody that can speak English, he's proud of himself, but at the same time, that you did excellent. I told you, the moment you give your interview for a spot, that means your file is excellent. I'm just want to prove that I'm going to get a good residence or not. So again, eye-to-eye contact, strong hands, shake really well, be proud of yourself. Always has a plan. What do you want in your mind? Don't be like, oh, maybe academic, maybe I want to do this. So if you show me your strong personality, that will help a lot.
Well, the 2 points coming from discussion on Facebook, Dr. Amir Al-Hajjaj, who is actually pediatric surgeon, maybe one of the few Jordanians who were able to match into pediatric surgery, he said, don't show off. Basically, be down to earth, basically trying to be friendly. So don't show off. That's a very good advice. What do you think, Yaqeen, the interview, preparing to the interview?
Yeah, أكيد this is very important. Be humble. وتاني إشي, always also remember to interact with all the residents from the program that are there, because we all know, and the program director is going to ask everyone what do you think about this, what do you think about that. مثلا even when you go out for dinner, don't think this is just like dinner. مع بيحاول يحكوا لكم إنه هو هيك, but try to have a good impression on everyone. Don't limit yourself خلاص بس تقعد مع واحد أو واحد تقعدي مع واحدة وإنه that's it. But try to mingle and talk to everyone and try to be memorable إنه بيتذكروك. try to إنه تحكي عن أشياء مشتركة. ultimately هم the Americans are pretty laid off, or they're easy to talk to بس إنه الواحد ما إنه يشوف حاله and you'll be okay as long as إنه تحكي مع كل الناس stay smiling.
Jadi, we have a message from Dr. Yasir Musa on Facebook telling you he will buy you a mansaf. Dr. Yasser Musa, our great teacher. Thank you very much for being with us today. Anyway, question, Muhammad Al-Afishat. What do you think about having green card or U.S. citizenship? Does this help in getting into surgery?
In my experience, I don't think they look at it. If you're, what matters is that you're an IMG, as long as you're not from medical school here, or other like basically recognized kind of medical schools. For them, it's all the same. A lot of them don't even understand that, like, you know, the J1 and the H1 and blah blah blah. Sometimes it's a disadvantage if you request is like, oh, I just want to come at H1, I don't want a J1. That could be a negative thing. But having a green card, in my experience, at least here at Hopkins, they did not care about it. As long as you're an AMG, they paint you with the same brush.
Okay. Very good point. Dr. Abdulrahman Al-Attili, who also had finished his general surgery from University of Florida, had brought is your upside scores during your preliminary years is very important. What do you think, Shadi?
It will be very important after your match, because it's, most of the scores, I remember most of the scores comes after the match. So of course, if you do a prelim second year, then you apply for a third year categorical or even a second year categorical, that will definitely help. There's no doubt. But most of the people that apply for prelim, they will end up, the match will come up, I think, even earlier, by a couple of weeks before the score, unless things change with general surgery, I'm not sure. But believe me, they know who's a smart one from the way you run, the way you take care of your patients. And alhamdulillah, all our training in Jordan is excellent in all our schools. So I think if you prove yourself, you'll be fine. But unfortunately, it's not going to help as a one-year prelim.
Okay, so somebody is asking if doctor is an entrepreneurship. Yani he's somebody who has done something great in his country in the field of medicine. Does this really help? And how he can sell himself in this, let's say, entrepreneurship things. What do you think, Yaqeen? Being an entrepreneur in something in Jordan as a physician and applying for surgery, does this really help?
I guess it's hard for me to answer that question because I didn't do that before coming here, but anything that will make you stand out will help is my answer.
Okay. Okay, Muhammad Al-Afishat?
Yeah, I think it definitely does, as long as you don't have any red flags. For example, if you failed your step 2 CS, being an entrepreneur will not help you. But if everything is, you know, passable, you have decent scores, this will be one of the things that make you stand out. A lot of program directors, they want a good story for each applicant. That's, oh, this is like, you know, a pianist, this one, like, you know, opened like the startup company, like something that they will remember. Just like Dr. Abu Halim said, like, you need to have something that they will remember you for, because they're gonna interview like hundreds of applicants. So you need to stand out somehow.
Okay, Shadi, can you tell us that don't do things during your, let's say, match process, that don't do things, like not things you should never do?
First, don't fail any step. That's like that's a big no. That will kick you out immediately of even application. Second thing is don't be very flashy during the interview. Again, we just said that. So you wear clothes that is like other people, you know, dark suits, nice dressed up. Don't come with the 5 o'clock shadow because you just don't want to shave your. I don't care if you have dermatitis, you shave that day. Don't speak bad about other people. That actually make me actually sour from inside. Even if you talk about, I hate to say that, about people from الولايات في Israel, don't say bad things about them, because they will hate that. If you talk bad things about a surgeon or a bad behavior, I ask this question all the time during interview. Give me an example of a good case or a bad case. And then one interview who has a really good score, he starts smack down and talk trash about the surgeon that works with, how bad he is. And I'm just like, immediately just scratch him out. So be careful about that. Be proud of Jordan. I know he's not perfect, but again, don't talk bad things. You're not leaving Jordan because it's bad. We're leaving Jordan to get a better training.
Okay, Muhammad, can you give more advice of don't, other than what Shadi had said that you should not do?
Yeah, I think, again, I agree with Dr. Abu Halima said about the cultural thing. I think a lot of the mistakes that our applicants do, it comes from a good heart. They didn't mean to say like something, weird. But for example, like don't say, like, there are other things, you have to be like very culturally sensitive. So if you spend time talking to, to like عندك قرايب مثلا بأمريكا, any other America, like even the social media, just kind of like get an idea of what is the current trends in the US. And I totally agree with you that currently, like, it's far left and it's very extremist, but you kind of have to be like, political about these automatic exclusion, about like, you have to be very like gender sensitive. You have to be, never talk about politics or religion. These are the three things that will be an automatic exclusion. Obviously right now, the whole political situation is very unstable and everybody is kind of primed and kind of emotional about the whole thing. But you have to be, very sensitive about race, about gender, politics, religion, that kind of thing. You just have to be neutral.
Yaqeen, anything else you can add, basically, before we sum it up?
Don't lie. Never lie. Like, that's super important, even like during surgical training. And don't be late.
Very, very good point. Very good point. So again, I would like to thank you, Shadi, Muhammad, Yaqeen, for such a wonderful webinar. I hope there were so many questions out there. I think we did answer most of them during the discussions. Just to summarize things up, basically, it is a possible thing, although the whole stigma at that let's say in the old days that it's not possible. No, it is possible. We have Jordanians who are graduated from Mayo Clinic, from Hopkins, from everywhere, and they are all over the world, mainly in the States, some actually in Jordan, some in the Gulf area. I hope this webinar would serve as a good, let's say, base for residents and for students to really think seriously about pursuing surgical career in the States, where I think there's a huge potential out there. Most of our graduates are very smart, they're very talented, they just need somebody to basically know them and know how good they are. And I'm sure, and I remember Muhammad Al-Afishat, he can talk about his experience with me when he worked with me at King Hussein Cancer Center. And I had no doubt that he would do great in the States. And I'm very proud to help mentoring him through all this career. Again, Habibi Muhammad, basically start from medical school, electives, research, preliminary, and I think everybody can make it. If I made it, if Shadi made it, if Muhammad made it, if Yaqeen made it, everybody can make it. Thank you very much, guys. Thank you very much.
Hakeem, I'm happy to share my email with the everybody on the chat or the live, just in case they have any further questions. I know there are a lot of questions we did not get to just because there's a lot of questions and we're limited by time, but I'm happy to answer any questions via email. I don't know how to just type it. Maybe chat here. Hold on.
Just say to all attendees, not to all.
Here you go. To all, not the panelists, to all, panelists and attendees. All right.
Yaqeen, thank you very much. Good luck in your board. I know that's been canceled the last moment, but I'm sure you guys will do well.
Yeah, I know. Inshallah, yani. We'll see what's the result of all of this. And thank you so much, Dr. Hamid, for arranging this. And Jad, والله يوفق الجميع. I'll send my email as well.
Thank you.
All right, thank you, everyone.
Excellent. One thing I have to say, I have to mention my dad. So when I applied in 2002, well, I was very pessimistic about, of course, applying. And this is for everybody. I said, Dad, I'm not applying. I'm going to stay in Jordan. I'm graduate from Jordan. He said, why you don't go to the United States? I said, because it's impossible to go. He said, is it very hard or it's impossible? And I thought about it. I'm like, it's probably very hard. And he said, well, then it's not impossible. You should apply. You should try. Take your time. You will get there, inshallah.
Thank you, Shadi. Thank you very much. Thank you, guys.
Thank you, everyone. Assalamu alaikum. Bye.